Hello everyone, and welcome to the series of videos recorded by the Department of Anatomy, Faculty of Medicine, University of Khartoum. This is Dr. Haitham Muhammad Qurashi, Teaching Assistant at the Department of Anatomy. Today we will have our second practical session in the region of the upper limb. In this practical, we will talk first about the anatomy of the female breast. Then we will talk about the muscles of the pectoral girdle. And lastly, we will talk about the muscles of the anterior and posterior compartments of the arm. Although the breasts are not anatomically part of the upper limbs, as they are located in the pectoral region in the anterior chest wall, their blood supply and lymphatic drainage is largely into the armpit, that is the region of the axilla, and that is why we are talking about them here today. So let's start our first station by talking about the anatomy of the female breast. The breast in an adult female represent an elevation of various size in the anterior chest wall. In the most anterior part of it is the nipple areola complex. The nipple is a dark protruding structure, while the areola is a dark area of skin surrounding the nipple. Behind the areola are the lactiferous ducts. The base of the breast extends from the second to the sixth intercostal spaces and from the lateral border of sternum to the mid-axillary line. The greater part of the gland lies in the subcutaneous layer just below the skin, while a small part of it, known as the axillary tail, extends upward and laterally and pierces the deep fascia just below the lower border of this muscle, which is the pectoralis major muscle, to enter the region of the axilla. The breast is composed of fatty part and glandular part. The amount of the fatty part varies from one female to the other, which result in variation in the size of the gland, while the glandular part is usually constant in size. However, it might be affected by the different physiological conditions like pregnancy and lactation. Internally, the breast is divided by connective tissue septa, known as the suspensory ligament of Cooper, into 15 to 20 lobules. Each lobule has a duct that travels and opens independently into the nipple. Behind the breast is a space filled by loose connective tissue called the submammary or the retromammary space, which houses a lymphatic plexus. So the breast is an elevation in the anterior chest wall, and the most anterior part of it is the nipple, then surrounded by the areola, and behind the areola are the lactiferous ducts, and the breast is composed of fats and glandular part, and behind the breast is the retromammary space, and this part of the breast is called the axillary tail that extends upward and laterally into the axilla. The first muscle which we will see in this station is this muscle, which is the pectoralis major muscle. This muscle originates from the sternum and the upper ribs and from the clavicle. So it has a sternocostal head and clavicular head. Here is the clavicular head, and then it goes upward and laterally to be inserted here in the lateral lip of the bicipital groove. The pectoralis muscle is innervated by the medial and lateral pectoral nerves from the brachial plexus, and its action is flexion, abduction, and medial rotation as the shoulder joint. In addition, if its area of insertion is stabilized, it can raise the ribs of origin. Below the pectoralis major is a smaller muscle known as the pectoralis minor. This muscle originates from the third, fourth, and fifth ribs and goes upward and laterally to be inserted in the coracoid process of the scapula, and this muscle is innervated by branches from the lateral and medial pectoral nerves as well. Then we have a small muscle connecting the clavicle to the first rib, which is called subclavius. It's a very small muscle originating from the first rib and is inserted into the clavicle and is innervated by a nerve to subclavius from the brachial plexus. Then we have this large muscle, which is serratus anterior muscle. This muscle originates from interdigitations from the upper 8 ribs and goes to be inserted in the medial border of the scapula. This is the scapula, this is the lateral border of the scapula, and here is the medial border of the scapula where the serratus anterior muscle is inserted. In addition, it is inserted to the inferior angle of the scapula. Serratus anterior receives its nerve supply through this nerve, which is the long thoracic nerve from the brachial plexus. The action of this muscle is to move the scapula forward around the thoracic wall and to do an action when you are elevating your arm above 90 degrees. So by tilting the scapula, you can elevate your arm above the 90 degree. Then we have this muscle here, which is called the subscapularis muscle. The subscapularis muscle originates from the subscapular fossa and inserted into the lesser tubercle of the humerus and is innervated by 2 nerves. One is this nerve is called the lower subscapular nerve, and another nerve here is the upper subscapular nerve. So the subscapularis is innervated by the upper and lower subscapular nerves. In the middle between those two nerves is this nerve, which is formerly known as the middle subscapular nerve, and is now known as the thoracodorsal nerve that innervate the latissimus dorsi that we will see in the next station. The muscles of the anterior compartment of the arm are the coracobrachialis, the biceps brachii, and the brachialis muscle. The coracobrachialis muscle originates from the coracoid process just lateral to the insertion of this muscle, which is the pectoralis minor muscle, and goes downward to be inserted here in the medial part of the humerus. It's innervated by the musculocutaneous nerve and is a weak flexor of the shoulder joint. In addition, it adducts the shoulder joint, but it's a weak adductor as well. Lateral to the coracobrachialis is this muscle, which is the biceps brachii muscle, and it's called biceps because it has two heads. This is the short head and this is the long head. The short head originates from the coracoid process as well, lateral to the origin of the coracobrachialis muscle. The long head goes upward and it originates actually from the supraglenoid tubercle. The two heads join each other to form the flesh of the muscle, and then the tendon that is inserted into the tubercle of the radius and into the bicipital aponeurosis. The most deep muscle is the brachialis, and the brachialis originates from the anterior part of the shaft of the humerus and is inserted into the ulna. The biceps action is flexion at the elbow joint, and it has another action which is supination, this action. In addition, the long head causes flexion at the shoulder joint. The brachialis flexes the elbow joint. All those muscles are innervated by this nerve, which is the musculocutaneous nerve. So, in this station, we will look at the rest of the shoulders muscles, and which are called the muscles of the shoulder girdle and the muscles of the posterior compartment of the arm. The first muscle that we will see here is this muscle, which is the trapezius muscle. This muscle has a very long origin from the occiput and the ligamentum noci and the spine of the seventh cervical vertebra and all the thoracic vertebrae spines. Then it goes to be inserted in the lateral one third of the clavicle, the acromion, and the spine of the scapula. This muscle is innervated by the spinal part of the accessory nerve, and the upper fibers raise the shoulder, that's shrugging of the shoulder. The middle fibers move the scapula medially, and the lower fibers depress the scapula. And in addition, it assists the serratus anterior in the its tilting effect on the scapula to help you to raise your upper limb above 90 degrees as the shoulder joint. Then we have this muscle, which is called the latissimus dorsi muscle. This muscle originates from the iliac crest, the lumbar fascia, and the lower thoracic vertebrae. Then it goes upward and laterally to be inserted in the bicipital groove between the teres major and pectoralis major. The teres major, this muscle is inserted in the medial lip, and the pectoralis major inserted in the lateral lip of the bicipital groove, and in the floor is the latissimus dorsi. This is called a lady, which is a latissimus between two majors. One of the majors is the teres major, and the other one is the pectoralis major. The latissimus dorsi is innervated by this nerve, which is the thoracodorsal nerve. Then we have this muscle, which is the deltoid muscle. It's a triangular muscle originating from the lateral one side of the clavicle and the lower part of the spine, and inserted into the deltoid tubercle in the lateral aspect of the humerus. This muscle is innervated by this nerve, which is the axillary nerve. Its action is abduction from 20 to 90 degrees, and above 90 degrees it's assisted by the trapezius and the serratus anterior. The posterior compartment of the arm contains one large muscle, which is called the triceps, and it's called triceps because it has three heads. This is one of its heads. This is the lateral head, and here is the medial head. So the triceps has a long head originating from the infraglenoid tubercle, a lateral head originating from the posterior aspect of the humerus above the spiral groove, and a medial head originating from the same area below the spiral groove. This muscle inserted into the olecranon of the ulna by this tendon, which is the triceps tendon. The triceps is innervated by this nerve, which is the radial nerve. Its action is extension of the elbow joint, and the long head allows this muscle to do extension at the shoulder joint. If we remove the trapezius muscle and we look at the medial aspect of the scapula, we will see three muscles. This is the first one, which is called the levator scapulae. This muscle originates from the first four cervical vertebrae and is inserted to the upper part of the medial border of the scapula. It's innervated by a nerve from the brachial plexus, which is called the dorsal scapular nerve. In addition, it has innervation from C3 and C4 nerves. The action of this muscle is to raise the medial border of the scapula. Below the levator scapulae is another small muscle called the rhomboid minor muscle. This muscle originates from the ligamentum nuchae, the spine of the seventh cervical and the first thoracic vertebra, and it is inserted into the medial aspect of the scapula, and it raises the medial aspect of the scapula upward and move it medially. Is innervated by the dorsal scapular nerve as well. Below the rhomboid minor is the rhomboid major muscle, which originates from the second to the fifth thoracic vertebrae spines and is inserted to the larger part of the medial aspect of the scapula. It's innervated by the dorsal scapular nerve as well, and its action is to pull the medial part of the scapula medially. If we move to the lateral part of the scapula, we will find this muscle, which is the teres major muscle. This muscle originates from the lower third of the lateral border of the scapula and is inserted into the medial lip of the bicipital groove. We mentioned this muscle when we talk about the latissimus dorsi, and this muscle is innervated by the lower subscapular nerve that innervate the subscapularis muscle, and its action is abduction and medial rotation of the shoulder joint. Above the teres major is the teres minor muscle. This muscle originates from the upper two-thirds of the lateral border of the scapula and is inserted into the greater tuberosity of the humerus. Its action is lateral rotation of the shoulder joint. It's one of the rotator cuff muscles along with the infraspinatus, the supraspinatus, and the subscapularis. Above the teres minor is the infraspinatus muscle. It originates from the infraspinous fossa and is inserted into the greater tuberosity, and its action is lateral rotation. Here we have the supraspinatus muscle originating from the supraspinous fossa. Here is the spine of the scapula, and above the spine is the supraspinous fossa, and from this fossa we have the supraspinatus muscle that goes laterally to be inserted in the lateral into the greater tuberosity of the humerus. Its action is initiation of abduction of the shoulder. The supraspinatus and the infraspinatus are innervated by the suprascapular nerve, while the teres minor is innervated by a branch from the axillary nerve. So those muscles, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis are called the rotator cuff muscles, in addition to the lateral rotation done by the teres minor and the infraspinatus, and the abduction done by the supraspinatus, and the medial rotation done by the subscapularis muscle, which is here. The function of those muscles is to stabilize the shoulder joint, as those two muscles stabilize the shoulder joint from posteriorly, the supraspinatus from above, and the subscapularis from anteriorly. So in this view we will review the muscles. Here is the trapezius, here is the latissimus dorsi, this is the deltoid muscle, the long head of the triceps, the lateral head and the medial head, the levator scapulae, the rhomboid minor, the rhomboid major, the teres major, the teres minor, infraspinatus and supraspinatus muscles. We have two spaces. This one is called the quadrangular space, and this is called the triangular space. The quadrangular space is bounded medially by the long head of the triceps, superiorly by the teres minor, laterally by the humerus, and inferiorly by the teres major posteriorly and subscapularis anteriorly. This quadrangular space contains the axillary nerve and this artery, which is called the posterior circumflex humeral artery. Below this space is the triangular space, which is bounded medially by the long head of the triceps as well, superiorly by the teres major and laterally by the humerus. It transmits the radial nerve and the profunda brachii artery.